and welcome to Health Matters on Channels Television. Thanks for joining us. I am Mary Alale Yusuf. Of approximately 600 neurological problems, epilepsy is one affecting about 65 million people worldwide. It registers as the fourth most common neurological disorder, and that's according to the Epilepsy Foundation. The World Health Organization estimates that only about 25% of those with epilepsy get adequate treatment in low and middle income countries. Epilepsy, a chronic neurological disorder which affects people of all ages everywhere, is characterized by different types of seizures. Public perception and misunderstanding of this disorder causes challenges some believe are even worse than the condition itself. My guest on the show is a consultant neurologist at the Lagos University Teaching Hospital, Idiaraba, Dr. Osigwe Agabi. You're welcome to the show.
Thank you for having me.
Let's understand what seizures are.
Okay. So, in looking at seizures, you must understand the concept of the brain. So the brain is made up of neurons, nerve cells called neurons, millions of them. And then, so these nerve cells interact with one another via electrical impulses and chemical substances. Now, when there's a surge in the electrical impulses by which these neurons communicate with each other, and then that is followed by a clinical manifestation, we say there's a seizure. So the clinical manifestation of a seizure is by itself determined by what the function, what the particular part of the brain does that is having that surge in electrical activity. So if that area controls movement, then what you're going to see as regards manifestation is going to be jerky movement.
Jerking of
Otherwise,
limbs.
if the area controls emotion, for instance, then what you're going to find is some abnormalities in emotions. For instance, if that area controls laughter, for instance, so what you're going to see as a manifestation of seizure might just be laughter, uncontrolled.
Oh, is this
laughter.
what happens during epilepsy?
Okay, epilepsy, by definition, is a disease of the brain characterized by a tendency to have repeated unprovoked seizures. To define epilepsy, the individual would have had at least 2 unprovoked seizures separated by at least 25 hours apart. So if this person continues to have seizures, we can now say, okay, this person is epileptic or is living with epilepsy.
When you say unprovoked, does it mean that there are no triggers?
Unprovoked means that it is not secondary to a cause. For instance, if somebody has a stroke, the person can seize. He can have a seizure. He can have 1 seizure, he can have 2 seizures, he can have 3 seizures.
Okay, so that's provoked because it's secondary.
Secondary to something.
Okay.
So usually unprovoked. So for those ones that are provoked, we call them symptomatic seizures. So after the event has been taken off, if the person has been treated for a seizure, it might not, for the stroke or maybe low blood sugar, the person ceases to have a seizure. So he doesn't qualify to be an epileptic. However, if somebody has a stroke now, he recovers, and maybe years later, he starts having seizures because of the scar in the brain. Then the person
caused by some other thing?
Even caused by the stroke itself. If it leaves a scar in there, that means that the person now has a tendency. There's something in the brain that's causing him that predisposes him to seizures. So this person can now qualify to be called an epileptic.
Okay, so you've mentioned epilepsy secondary to stroke, low blood sugar, head trauma. Is it among those that cause secondary seizures?
So the causes of epilepsy are, one, by far the commonest cause of epilepsy we don't know. In about 80% of patients who have epilepsy, the cause is unknown.
So those are the idiopathic types.
Idiopathic epilepsy. Okay. Now, epilepsy can occur following infections of the brain, meningitis, encephalitis. Epilepsy can occur from trauma. So people can have post-traumatic epilepsy, for instance. There's an accident, the person recovers from the accident. Maybe years later, the accident has destroyed a part of the brain. That part of the brain becomes epileptogenic. It now becomes a focus for abnormal electrical discharges.
Okay.
So that person now qualifies to be called an epileptic or person living with epilepsy. Hypoglycemia, which is reduced blood sugar, is not a cause of epilepsy. It can cause seizures. But when you control the blood sugar, it is unlikely that the seizures will continue. However, if the hypoglycemia has lasted for a long time, so much so that it causes a brain injury that is enduring, that leaves a scar in the brain, later on the person can go ahead to develop epilepsy or repeated seizures. Okay. But within the acute period of the low blood sugar, it is not defined as epilepsy. You can just at best say the person is having seizures due to the low blood sugar.
Okay, you know, you mentioned some manifestations depending on where the abnormal discharge is taking place. It could affect the limbs, it could affect laughter, and maybe some other things. Now, what I want to know is, how does epilepsy manifest? People believe that it's always with jerky motions, but is that true?
Okay. Well, epilepsy, by far the commonest form of epilepsy that people see or that people recognize is the jerky convulsive seizure.
Yes.
Okay? But, you know, like I said before, that the brain is made up of a meshwork of neurons that interact with each other via electrical stimulus. Now, depending on which part of the brain is affected, if that area is for movement, then what you're going to find is abnormal, excessive, jerky movements. If the area is for emotions, then you have some emotional disturbances. So in a sense, simplistically, you can say, okay, seizures can be divided into two. You can say the ones that are convulsive, which means that patients jerk, and the ones that